So I think one of the reasons it's important is, as you know, like key populations are some of the most marginalized populations, and oftentimes they face huge amounts of stigma, discrimination,
yes, that's true.
and gender-based violence, and oftentimes that really impacts them being able to access health services.
The U.S. Embassy of Windhoek, together with the Ministry of Health and Social Services, will formally open Namibia's first Share Fair event tomorrow at the UN Plaza in Katutura. And this is a public event organized by USAID's PEPFAR, funded by key populations under IntraHealth in Namibia, at which key population-led organizations will provide information and promote HIV prevention, treatment, and care activities at exhibition stores. And the Share Fair is, of course, held in conjunction with World Health Day, which is celebrated today, the 7th of April. And, of course, joining me in the studio is Laura Muzart, USAID Technical Advisor for HIV/AIDS prevention, and she's, of course, responsible for USAID's Key Populations Program, KP-STAR, and she's going to tell us more about this event that is, of course, happening tomorrow. Good afternoon to you, Laura, and thank you so much for joining us here at 99 FM.
Afternoon, and thank you for having me.
It is a pleasure to have you. Let's talk about the event. Can you elaborate a bit more on the event that is happening tomorrow? What time does it start? And, of course, who can attend?
Okay. I think you did a great intro kind of outlining the event itself, so thank you. You made my job a lot easier. But overarchingly, tomorrow people can start arriving. The event starts at 10, but people should arrive earlier. And it will just be an opportunity to, we'll have the charge of affairs from the U.S. Embassy, as well as the Minister of Health and Social Services participating, and the Namibia Chamber of Commerce,
of course,
as well as other representatives, and they'll be speaking at the event to kind of just note how important this initial Share Fair is. And then from that, we'll be able to walk around to all the different stalls, and at that time, you'll be able to meet and talk to the different organizations that are KP-led.
Of course.
And they'll go through and talk about the different programming that they do, focused on, as you pointed out, the HIV prevention, care, and treatment, but they'll also talk about the COVID-19 programming they do, and they also do other programming that's not specific to PEPFAR, so they'll kind of outline that. And I think it will just give an opportunity to everybody to help learn what they do, and then find out from on their side, how they can better collaborate and interact with these different private businesses and organizations.
Of course. Before we get to our next question, the theme for this year is, because the event is happening because we are celebrating World Health Day today, the theme this year for World Health Day is Our Planet, Our Health. Just in your own opinion, before we move on, what does that mean to you, the theme for this year?
So I think the fact is we have to look at sustainability, right? Sustainability, Earth, and our health. And I think that's one of the reasons this is really great, because it kind of combines from the health sector within how do we keep our programming sustainable, and how do we make sure that we're able to support the key populations down the road. And so it's looking at it from that lens, which I think is really just great, and it provides a really unique opportunity to have people touch base and talk to each other.
And especially talking to each other, very important, the communication part, very important. Which key populations, Laura, are more at risk of contracting HIV?
So the populations that are most at risk are female sex workers, men who have sex with men, and transgender persons.
All right. Okay, that's a quick and easy answer there. And also, how is Namibia progressing in the UNAIDS fast-track targets of 95, 95, 95? And can you please, also for myself, explain to myself and our listeners what that means exactly?
Okay, so for the 95, 95, 95 means that 95% of those individuals that have HIV test, and 95 of those know their status, 95 of them get on treatment, and then 95% of those that are on treatment are virally suppressed. And so I think that's what everybody's striving for. And as a country, Namibia is very progressive against the 95, 95, 95. We're at epidemic control, which is really great. Within the key populations, there are some gaps. I won't be able to give you the exact numbers, but we fall short in actually identifying more and more of the key populations that need to test, especially men who have sex with men. And I think that's one of the reasons, looking at sustainability, it's key to making sure that they have access, down the road, not now, not in the next couple of years, but, further down the road, like 5, 10 years.
And also, why, Laura, why is it so important for the U.S. government to support these key populations, and for how long can we expect the support from the U.S.?
So I think one of the reasons that it's important is, as you know, like key populations are some of the most marginalized populations, and oftentimes they face huge amounts of stigma, discrimination,
yes, that's true.
and gender-based violence, and oftentimes that really impacts them being able to access health services. And so I think from PEPFAR's point of view and the U.S. government's point of view, we need to make sure that those individuals, they're accessing the services they deserve. And that's working with, you know, the health sector as well as social services and private sector, and making sure the services that they need are KP friendly, and so just provided without stigma, discrimination, non-judgmental, and making sure that we do what we can to ensure that if they are positive, they get on treatment and they stay on treatment until they're virally suppressed, and then if they're negative, that they can access PrEP. So that way they stay negative.
Stay negative, yes.
And I think when we look at how long, you know, the terms of the length of time, part of what this fair is kind of starting out some of the discussions around sustainability. And those are happening with the U.S. government and the Ministry of Health and Social Services in terms of, and the KP populations, like what does sustainability look like for our programming? And this is a first step in terms of, it's not the first step, we've been doing it, but this is a really unique step to kind of move this forward.
Yes, yes. Also, I just want to know, I mean, this is the first time it's happening in Namibia. Can we expect this to happen every year in celebrating World Health Day, or is it just going to be for this year?
So I think what we want to do is look to see how it was, like, you know, how beneficial was it to the populations? How beneficial was it to the private, you know, the private sector and the industry and people that are part of the event? We hope that it will turn out really well and that we will continue with it. So that's the hope, that we will continue and have
for it to be an annual thing. Just again, Laura, before we let you go, just those details again, where it's happening, what time it's starting, and until what time will it be running? Okay, so it starts tomorrow at 10 a.m. and it's at the UN Plaza. And it will run till a little bit after 12:30, and there will be light snacks provided. Yes, and we love snacks. We love snacks. We love snacks. If you want to buy anything. Yes. And so we'd love to have everybody come out and kind of meet the organizations and find out a little bit more of how they can help in terms of the programming and getting more access to services for key populations. Laura, thank you so much for coming to share with us. It was an absolute pleasure to meet you, and I might come pop in tomorrow because I'm not going to be at work tomorrow, so I might come pop in tomorrow to come see how it goes, and of course hope that next year we can still have the Share Fair, because I'm sure it's going to help a lot of people, and of course having those conversations as well, like you mentioned. So thank you so much for coming to share with us this exciting fair news, and looking forward to speaking to you again soon. Perfect. Thank you. Hope to see you tomorrow. See you tomorrow. As of course, Laura Muzart in studio talking about the Share Fair, which is happening tomorrow, by the way. It's starting at 10 a.m. at the UN Plaza in Katutura. There's snacks, guys. I know we all like snacks. So go, you know, talk and mingle and learn and snack at the same time. That was, of course, MYD Heart for today.